I really want
Mhm.
parents to understand us as pediatrician, what we're supposed to do, what we do. We have about 20 minutes to do a physical. And if we're
Mhm.
lucky, and in
Mhm.
that 20 minute, we have to address so many issues from their oral hygiene to their vital signs to their school to examining them to talk about their diet to talk about reading habits. We have to really make the most out of that time. And in a few minutes that we can really dedicate to that, we may not always be successful at diagnosing it. So we really rely on parents on what they tell us to really make the diagnosis as well. So we have these questionnaires that they are standardized, they're proven by research that it works. So we have parents do that, make our job a little easier. For a teenager, we talk to them alone after a certain age and we run those questions. Is there anything I need to worry about? So we try to elicit some of those feelings and information from them, and building that trust over time, that's helpful. If I'm seeing you for the first time, sometimes that may not happen the first visit or two. And then, the things that we see in the office, their affect, the way they behave, the way they talk, the tone of their voice, and of course, questioning about the grades. And so we try our best, but you have to realize in that short period of time, it's not an easy thing to do. And I want parents to be aware of that. So parents are going to have to be the best advocate for their kids. So if they see something they're not sure, if they see something that's worrisome, I really encourage them to ask. It doesn't hurt. I think you're much safer asking. And then in the private conversation we have for our kids who are 14 and 15 and above, try to listen. So this is, very confidential. I'm only here to educate you. I'm not here to tell you what to do. So if there's something I can help, this is your time. So these areas that we get a chance to talk to them and try to get that information. And as much as I want to think I'm pretty good at successful at it, most of us pediatrician, but again, we miss a lot. Whether we want to agree to it or not, or admit to it or not, it's difficult in that 20 minutes to cover so many things. And so again, parents, best advocate for the kids, and please ask us. I know we can direct you to the proper venue if there is a concern, if there's an issue. Be a better communicator with your kids. God, sometimes we're terrible at implementing that love. If you don't like it, it's not because I'm trying to offend you. I'm telling you this not because I want to get you out of my hair. It's because I care for your child. I mean, the pressure on them is tremendous, and dealing with all of those, satisfying us demanding parents